Again, this is not warning about what might happen. The hospitals in the state are full, including the pediatric hospitals. And the case numbers are rising every day. They got 6,000 and 7,000 new cases every day. That means, 500 hospitalizations over the course of the next few days, according to the state medical director. When the flagship hospital in the state has announced that every hospital in the state is at capacity, when they're announcing they're between 5 and 10 days away from total failure of the hospital system in the entire state, this is trouble. I mean, total failure of the hospital system doesn't mean the hospitals close, but it means if you call 911 and you can get yourself an ambulance, the ambulance will turn you away at the hospital. Again, that was the word today, this afternoon, from the University of Mississippi Medical Center, which is in Jackson, which is in the state capital. Today, also in Mississippi, NBC reporter Ijlal Babar went about 150, 200 miles southeast of Jackson down to Ocean Springs, Mississippi. It's vaguely near Gulfport, Mississippi, right on the Gulf Coast. Ellison went there to try to understand what this kind of situation in Mississippi means on the units, what it means for doctors and nurses in Mississippi right now who are in the midst of what is a national level crisis, trying to hold back this tidal wave of new, very sick patients as the state exhausts its resources. I mean, part of what Ellison heard is that the fact that so many younger people are getting so much sicker now is driving a lot of how hard this is right now on doctors and nurses. Here's Dr. Ijlal Babar. He's the director of critical care at Singing River Health in Ocean Springs, Mississippi.
There are often family members who want to talk to us, and one of the most difficult things is discussing end of life, and worsening status with family members of these young patients. So whereas before we were talking to children of these elderly people who were often prepared in their minds for eventual demise, now we're talking to parents, we're talking to young spouses, and then they tell us that this patient has a 10-year-old or a 15-year-old, and it breaks our hearts. When you start talking about end of life with people like this, and in this age group, it's very difficult. It's very difficult. And the reactions we get are, some people are just dumbstruck, some people are angry. It just varies. And then, of course, we have to go and take care of these patients at the bedside. Dr. Baral was putting a chest tube in one patient, and then she's going to go to the next bed and put a chest tube in another patient. So you're basically going from one room to another, and at the same time you're getting calls from the ER about more people rolling in. So it's just constant. I wish our governor would step up and say very clearly how important the vaccines are. I think that everyone, in every way they can, should come out and say it so that people can be encouraged to go and get vaccinated. Because otherwise, until it hits you, you don't realize what it means. When your own loved one is dying, that's when it means something.
Dr. Ijlal Babar is the head of critical care at Singing River Health in Ocean Springs, Mississippi, again, down by Gulfport, Mississippi. He went on in this interview today to say that one of the challenges that they are sort of growing into now is nurses who are working so hard and working, double time, triple time. Nurses finding that ultimately they cannot keep working in the ICU. They can't take it anymore under these circumstances, in part because of the frustration, as he put it, that almost all of this suffering could be prevented if people just got vaccinated. Frustration over that is driving nurses to leave critical care at this critical time. Also, just with these relentlessly increasing numbers of very sick people now, they're also just exhausted and they can't go on.
We have a solution by getting the vaccine and wearing our masks and doing what we need to do. We're tired. Nurses are so tired. It's getting to the point where we need help. We've been helping as much as we can, and we need help from, our community. I respect everybody's choice to get vaccinated or not, but when it comes down to it, it's going to just continue to get worse, and it's going to get to the point where it affects our kids. That's my biggest fear, is that it's going to keep mutating, and we could have done everything in our power to stop it and, eradicate diseases just like vaccines are supposed to do. And if it keeps going like this, then it can get to a point where it hurts our kids. And we already have, kids on vents in different parts of the state. And if, we won't be able to say that we did everything to protect our children. I know people that would take a bullet for their kid, that it can be as easy as taking a shot. So, as a nurse, it does wear on you to feel like it's not coming to an end anytime soon. So that's...
Are you surprised it's still this bad?
Yeah.
A year and a half. How do you keep doing? How do you find the strength to do this again and again and again?
Really, I don't have any strength left in it. Honestly, I've given so much, I can't keep going. That's why I decided to move to a different department, because it's affected me in ways that I never thought possible, and it is not going to get better, and I have to protect myself and my family and my sanity, because if, people aren't doing what they need to do to protect us, and, we're human. We're not robots. We're not machines. We can't continue to do this forever at this capacity.
You're a nurse on the ICU floor right now, but you're not going to be.
No, I can't do this anymore. I've seen more death than I ever thought that I would see in my entire life. I've held more hands of patients in the last moments when their families couldn't be by their side, more than I ever thought that would happen. I know this is the ICU and people pass, and it shouldn't be to this level, though. When I chose to be an ICU nurse, I knew this was what I signed up for, but I don't think anybody really realized that this was going to be part of the deal, that this was going to be this exhausting in every way. It's just heartbreaking in every way. I don't even know how to describe it. It's overwhelming, and I can't. I can't even really speak about it anymore. I'm so exhausted from the mental strain of the process of this. Just that it's all you hear, it's all you see. It's this whole debate about vaccines, and then coming in here, and you wake up every morning and you know that it's just going to be the same devastation as the day before. There's not really, it's always a win when somebody leaves and goes home, but they never go home the same way that they came in.
Jen Sartin is a nurse at Singing River Health in Ocean Springs, Mississippi. That was her speaking with our colleague Ijlal Babar today from their critical care unit, which is overwhelmed, completely at capacity, just like every other critical care unit and every hospital, full stop, in the state of Mississippi is right now. The state health officer in Mississippi warned at the beginning of this week that with 6,000 and 7,000 new cases being reported in the state every day now, quote, this will translate into around 500 new hospitalizations in coming days, while we have 0 ICU beds at level 1 through 3 hospitals in the state, and we already have more than 200 patients waiting in emergency rooms to get a hospital room. That, as I said, has led in Jackson today to a new hospital unit being set up in the parking garage at the University of Mississippi Medical Center. That will be staffed by dozens of medical personnel being shipped in as a disaster management team from the federal government. It means the hospitals and ICUs, even the pediatric hospitals everywhere in that state, are totally full. And down in Gulfport, as you saw, it means that nurses are too heartbroken, too frustrated, and too exhausted to keep going to work in the ICU day after day. They just can't do it anymore. I know we've been talking about COVID and front-paging COVID stories for a long time now, for a year and a half now, but this is new, what we're seeing now. The COVID disaster that is unfolding, particularly in the South right now, definitely unfolding in states with low vaccination rates. It is getting to be a next level disaster. We didn't previously see states talking about entire hospital systems failing statewide. Mississippi thinks it's there within the next 5 to 10 days. I mean, you can see the strain in the states if you look bad enough, if you look closely enough. This is a bad enough situation in the states now that it's also going to be a new test, I think, of the federal government's ability, the Biden administration's ability to target literally disaster resources to places in our country where the health system fails. Because that is starting in some states, and you're seeing that with the deployment of this disaster management team to Jackson, Mississippi. This is very stark stuff. This is not like it has been. It is time once again to start thinking about what we all can do to support health workers in our lives. I mean, you know, the first thing they'll tell you is to get vaccinated and get everybody in your life vaccinated. That's the best thing you can do for them. But beyond that, doctors and nurses and respiratory therapists and people who work on the front lines in these now increasingly swamped hospitals over huge parts of the country, they are a group of our fellow Americans who are going to need not just, you know, recognition and thanks, but they're likely to need help from the rest of us, given this, you know, superhuman thing that we are asking them to do. Now, piled on top of it, the additional frustration and heartbreak and anxiety, knowing this could be preventable if there were greater uptake of vaccines. It's just a serious thing. All right, so there is a lot of news